Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to your YouTube channel, The Anatomy Canvas. Today we are going to discuss with the development of the sinus venosus. So sinus venosus, middle of the fourth week, the sinus horn receives venous blood from both right and left sinus horn. In this diagram, you can see this is the right sinus horn and this is the left sinus horn, and the heart receiving its blood supply from both of these horns. And these horns receives their blood from through three pair of the vessels: the vitelline vessels, the umbilical vessels, and the cardinal vessels. These are the vessels of the right side, and these are the vessels of the left side. At first, the communication between sinus and atrium is wide. Soon, however, entrance of sinus venosus shifts to the right side, and shift is caused primarily by the left to right shunt of the blood, which occurs in venous system during 4th and 5th week of development. So in this diagram, you can see the right umbilical vein also disappears along with the left vitelline vein, and there is a shifting of the blood from the right to left shunt of the blood, which occurs at this stage. So this is the diagram of the embryo, which is showing the developing heart, its venous and its arterial end. So arterial end, the outflow region, is attached to the aortic sac by the aortic arches, and the venous end, which is receiving the blood from the umbilical, from the vitelline vein through the yolk sac, from the umbilical vessel through umbilical cord, and from the common cardinal, which soon divides into right and left, or anterior and posterior cardinal vein. The anterior cardinal vein receiving blood from the cranial part, and the posterior cardinal vein receiving blood from the distal part of the body. This is another diagram in which you can see initially both the sinus horn are present, and these veins, these two sinus horns are equal in size, and the heart atria has a wide communication with these two sinus horns. With the changes which are occurring, the right umbilical vein disappears along with the left vitelline vein, and also an anastomotic channel appear between the anterior cardinal vein of both sides. So because of these all the changes, there is a shunting of the blood from the left to right side, and as a result of this shunting, the right sinus horn loses its importance, and it is only indicated in adult heart by the right coronary sinus and oblique vein. Again, in this diagram, you can see the equal size of both sinus horn, and here you can observe that the right umbilical vein has been disappeared along with the left vitelline vein. In this diagram, you can see the right vitelline veins are present, the left umbilical and the left sinus horn is present. This is the back side of the embryo showing the left sinus horn and the right sinus horn. These are the atrial swelling, and these are the ventricular swellings. In this diagram, you can see the common cardinal vein which is present, and the left sinus horn, the umbilical vein is present. On this side, you can appreciate that the right vitelline vein is present. This the heart tube has started to fold, and this is the area of the bulbous cordis. This is the common atrium and the common ventricle. So what happens next, that with the obliteration of the right umbilical and left vitelline vein during 5th week, left sinus horn loses rapidly its importance. With the left common cardinal vein is obliterated at 10th week, all that remains of the left sinus horn is the oblique vein of the left atrium and the coronary sinus. So as a result of left to right shunt of the blood, the right sinus horn gains its importance and its vein enlarges. In this diagram, you can appreciate this is the coronary sinus, and this one is the oblique vein of the left atrium. These are the pulmonary veins, and behind it is the pulmonary artery and then aorta. This part is developing into superior vena cava and inferior vena cava. Again, a detailed view of the both the sinus horn on left side. You can see this is the right coronary sinus which is forming an oblique vein, and the right sinus horn gaining its importance. Also, the sinoatrial junctions is now incorporated. It shifts onto the right side. So in this diagram, again the same diagram. Again, in this diagram, you can see the shift of the sinoatrial junction on the right side, and this is inferior vena cava, this is the superior vena cava, and this is the left sinus horn. So what happens next, that the right horn, which now forms only communication between original sinus venosus and atrium, it is now incorporated into the right atrium to form the smooth walled part of the right atrium. In this diagram you can see this blue area. This is the right sinus horn, which is incorporated into original atrial cavity, and it is forming the smooth walled part of the right atrium, which is called sinus venereum. As a result of incorporation, two ridges or two valves are formed. This is the right sinus valve and this is the left sinus valve. These two valves meet superiorly to form the septum spurium, and the right septum spurium and left sinus valve later on fuses with the developing interatrial septa, and the superior part of the right sinus valve disappears while inferior part of the right sinus valve form the valve of the inferior vena cava and coronary sinus. This is the dividing line between the smooth walled part, that is sinus venereum, and original atrium, which is now trabeculated part, and this line is indicated by the sulcus terminalis. So again, in this diagram you can appreciate the left sinus valve, the right sinus valve, their fused part forming septum spurium, and the other changes which are occurring at this stage. These are the inferior endocardial cushion, and the septum primum has started to develop at this stage as well. So the septum spurium and left sinus valve has been fused with the septum secundum. Sinus venereum is now formed. This is smooth walled part, and this is the crista terminalis, which is dividing line between smooth walled part and the trabeculated part of original right atrium. And this is the valve of the coronary sinus, and this is the valve of the inferior vena cava. Initially, valves are large, but when right sinus has been incorporated into valve of atrium, the left venous valve and septum spurium fuses with developing septum, which I have shown over here to you. The superior portion of the right sinus valve disappear entirely. This is the superior portion, and it also disappears, and inferior portion will form the valve of inferior vena cava and valve of the coronary sinus, and this is the crista terminalis, which is dividing line between smooth walled part and the rough part. Again, another diagram showing you the left sinus horn, which is now forming the coronary sinus and oblique vein, and this is the pulmonary vein and the pulmonary artery, aorta, the superior and the inferior vena cava. So up till now we complete our lecture. These are the references: the Langman's Medical, Embryology and Gray's Anatomy. And thanks you all for your attention. Till the next lecture, Allah Hafiz.